Hi, Coke Scholar family and friends. Welcome to The Sip, the podcast that shares a taste of how Coke Scholars around the world are igniting positive change. This season features amazing panels of scholar experts discussing interesting and timely topics. My name is Aisha Shebi, and I'm excited to lead you through this season. I'm a proud 2020 Coke Scholar, originally from Miami, Florida, and now a junior at Princeton University studying medical anthropology. I also have my own podcast called The Hybrid Podcast. For those who are listening and may not be a Coca-Cola scholar, welcome. We're so glad you're here. To give you a little background, the Coca-Cola Scholars Foundation is the largest achievement-based and corporate-sponsored scholarship program in the country. Each year, it awards $20,000 to 150 high school seniors across the country who share a unique passion for service and leadership. There are now over 6,000 Coke Scholars creating positive change around the world. If you want to learn more, you can visit their website, coca-colascholarsfoundation.org. For our final episode of Season 3, we will be joined by scholars Anthony Lim, Joelle Burvell, Athena Kan, and Kaitlyn Chana. They will discuss disparities and shortages in the healthcare industry, how to lead with heart, and more. Let's learn a little about them. Dr. C. Anthony Lim, a 1997 Coke Scholar, is the Director of Pediatric Emergency Medicine for the Mount Sinai Health System and the Medical Director of the Pediatric Emergency Department and Short Stay Unit at Mount Sinai, Beth, Israel. He is also an Associate Professor in the Department of Emergency Medicine, Pediatrics, and Medical Education at the Icahn School of Medicine at Mount Sinai. Joelle Burvell, a 2013 Coke Scholar, is a Ghanaian-American medical student at Washington State University. Committed to fighting health disparities in medicine through education, he regularly highlights racial disparities and biases in healthcare on social media, where his platforms have over 500,000 followers and 65 million impressions. Athena Kan, a 2015 scholar, is the CEO of Dreambound, which is creating a new supply of healthcare workers, starting with certified nursing assistants, paying for their training, and matching them to programs and employers. Athena previously worked at Johns Hopkins researching minority health disparities and started the nonprofit Coding It Forward to help government agencies modernize their systems. And finally, leading this conversation is 2009 Coke Scholar Kaitlyn Chana. Following a decade in the news industry, Kaitlyn felt compelled to amplify people's voices to create change in the healthcare industry and obtained her Master's of Business Administration and Master's of Health Administration from the University of North Florida. Kaitlyn is joining Texas Children's Hospital as their incoming administrative fellow. Now, let's learn from these wise healthcare professionals.
Today's topic is really exciting. It's about improving healthcare systems. And basically, we all know that the goal of this podcast is to share a taste of what Coke Scholars are doing around the world to ignite positive passion. And so I'm excited because I'm a Coke Scholar myself, and I'm Kaitlyn Chana, and we have three other incredible Coke Scholars here who are going to briefly share a little bit about where they are presently, what they hope to be able to see in healthcare, and then I will conclude with my introduction, and then we'll jump into just a conversation about what we've seen in healthcare in the past, the present, and future. So without further ado, the first person that I will introduce is Dr. Anthony Lim, who's a 1997 Coke Scholar. Can you start off by sharing a little bit about where you're at in life?
Yeah, it's great to see you, Kaitlyn. Again, my name is Anthony Lim. I was a 97 scholar. I am a 97 scholar. I grew up in Virginia Beach, Virginia, and went to school in Virginia. Subsequently went to medical school in New York. And then now I am the Director of Pediatric Emergency Medicine for the Mount Sinai Health System.
Well, thank you for sharing. And then we're going to pass it over to Joelle, who's also well known as a superstar on social media. Joelle?
Hey everyone, my name is Joelle Burvell. I'm a 2013 Coca-Cola scholar. I grew up in a little bit north of Seattle, Washington, in a town called Mukilteo, but I currently live in Portland, Oregon now, where I'm a medical student at Washington State University. So a little bit overview of my journey. I started off in the West Coast, but hopped over to the East Coast for undergrad, went to Yale and graduated in 2017. did my master's in medical science at Boston University, then decided to come back to the West Coast for medical school. So I'm entering into my 4th year right now, but I'm actually going to be taking a research year and will be in Baltimore at Hopkins for 1 year, doing some research on orthopedic surgery. But really what I do right now on social media is I talk about healthcare disparities that exist in the field of medicine. I know as we're talking about improving the healthcare system, we'll definitely have to be talking about healthcare disparities, how they exist, and the things that we have to do in order to improve them. So excited to have that conversation.
Yes, and we're excited that you're able to provide your insight specifically in that area because we've seen a lot over the last 3 years when it comes to healthcare disparities. Well, Athena, if you don't mind sharing a little bit about your work and what you currently do.
Yeah, I'm Athena Kan. I am a 2015 Koch Scholar, grew up in Maryland, but now living in San Francisco. Right now, I'm co-founder and CEO of a company called Dreambound. Our vision is to create upward mobility for Americans by getting people started in trade jobs. So we're starting out with certified nursing assistants, which are kind of the people who work in nursing homes and hospitals, things like that, doing the real work there. But eventually we're going to expand into things like medical assisting, EKG technician, RN, LVN, things like that. So we pay for people to go through training. We match them to training programs and employers. And right now we're serving some of the biggest higher employers of CNAs out in the country. So big nursing homes like Brookdale, hospital systems like Tenet.
And that's a critical need because we're going to be talking about shortages and retention and employment. And that's a hard thing right now in the healthcare industry as a whole collectively. So thank you, Athena. Well, I'm also a Koch Scholar. I'm a 2009 Coca-Cola Koch Scholar, I should say. And I was in television news for more than a decade, fell in love with people's stories. And that's what led me into that direction. And then as a reporter, I covered a lot of healthcare related stories at Mayo Clinic. And I was in a medical hub at the time in Jacksonville. And I just fell in love with the business side of healthcare and then kind of upped and quit my job, decided to go back to school, obtained 2 master's degrees, one in health administration, the other in business administration. And now currently just moved to Houston, Texas, just recently, and I'll be starting at Texas Children's Hospital as an administrative fellow. So a little bit of a 360. So we have a little bit of everyone on this panel. Well, to get started, I wanted to kind of start out. I know like the last 3 years, at least for myself too, has been an eye opener just because of what we've seen with COVID. We were talking about innovative solutions to just persistent challenges that we constantly see in the news. So I was hoping that maybe Anthony, if you don't mind starting out by just sharing, like, how has healthcare either changed or evolved from a frontline perspective by your experience of working in the emergency?
Yeah, no, absolutely. The last couple of years have been both a blur and also slow motion. I will say that from the onset of the pandemic in March of 2020, what we found was a real need to integrate our system. Our health system has 7 emergency departments. There are 3 pediatric emergency departments. And for us to be able to care for the onslaught of patients that came, we needed to be able to coordinate and collaborate. And that meant shifting resources, which include people, supplies. We needed to load level the number of patients that were inundating our hospitals. And so, what came of it was a much more integrated health system. And now working towards using that example in order to fix very common problems across, that impact patients, impact their families, have downstream effects on both our supply chains as well as the way that we take care of patients. So I think those are the biggest sort of changes. On the staffing and person front, I think it has really hit it home that, healthcare providers are people too, that we have healthcare needs, including mental health needs. I think the trauma of the last couple of years, not just in taking care of patients, but, we took care of each other at many points too, has really hit its toll. And whether that is, healthcare is not absent from the Great Resignation. There certainly is a very notable shortage of staff, especially in terms of nurses in the field, and being able to approach that in a way that we can recruit and retain and sustain the wellness of everybody in our field, I think is become a really paramount issue for us.
I agree, and you tackled many issues all in one, and just in one soundbite in a sense. So I was going to ask, like, Athena, if you don't mind sharing too, to piggy off that. I know you already talked about being CEO of Dreambound, but when we talk about just a shortage of workers, specifically nurses, you mentioned tuition free. So that is an added advantage for people that are wanting to get into healthcare. What do you mean by that? And how do we hope to be able to see that influence the numbers in the future?
Yeah, I mean, Anthony is totally right. And the shortage is getting even more insane with COVID, has been insane with COVID. But the problem is that even before COVID, these hospitals, nursing homes have been understaffed for decades. And so COVID only made it worse. I think what was really cool and enlightening to see was during the pandemic, you also had a lot of people raise their hands too, and they wanted to be able to serve their communities. They wanted to serve these vulnerable patients. But what we've seen even before the pandemic and now is that a lot of people who are incredibly motivated, incredibly compassionate, would be great caregivers for others. What's often stopping them is the price of going through school. And these classes, they're not that expensive for people, like us who are working full-time jobs, but they can be $1,000 to $3,000. And for someone who's living paycheck to paycheck or unemployed or working part-time, that can be pretty infeasible to overcome. So at Dreambound, we pay for people to go through school. In exchange, they commit to working at one of our partner employers. And that kind of is a win-win solution for everyone, where someone gets their tuition paid for, they get to become a certified nursing assistant. And on the other side, you have employers who really need to hire great people are now able to access this pipeline of talent that they wouldn't be able to otherwise access.
And that's a lot of great work that's being done. And Joelle, I was going to say, you're also assisting in that same area through your mentorship program. Can you elaborate how you are kind of aiding and trying to ensure that there isn't such a huge gap in the foreseeable future when it comes to healthcare workers?
Absolutely. And I definitely want to second what Athena was saying about how expensive it is to go through medical school, to even apply into medical school, to then go into residency afterwards, the application fees. It's insane. But one thing I want to highlight when talking about that is ways that you can actually mitigate that as well. So you mentioned mentorship. I think one of the big problems is that many students can't see themselves in positions in terms of being a physician in the future or in a healthcare career. And so for me, my mentorship program is all about getting students to see people like themselves and to early on be able to get access to healthcare resources, to physicians, to understand how do you have to take the MCAT, what do you have to do, what college should you go to, what should you major in, all that kind of important stuff to apply into medical school. But it's beyond that. It's also making sure students have resources like the Coca-Cola scholarship, where they can fund college to be able to go through at a reduced rate, so that when you get to medical school, you can actually pay for these things. And I think COVID also really shone a light on the healthcare profession as a field that is both noble and also able to have a huge impact on the lives of other people. In 2021, actually, the American Association of Medical Colleges saw that there was a 18% increase in the amount of applicants that applied into medical school. And some schools even saw like a larger increase in that, with, I think it was 24 schools reported like a 25% increase in applications in 2020. And a lot of people started calling this the Fauci effect, saying it was because Dr. Fauci was on TV all the time. People were saying, oh, I want to go into medicine. But I think there's another explanation for it. And it was that medical schools started realizing how prohibitive it was for people to apply into it, the cost of things. So many schools waived the MCAT, which is the exam you have to take in order to get into medical school. Many schools didn't have in-person interviews anymore. So that means people aren't having to pay for traveling to hotels or staying and actually having to stay 2 nights or buying meals and flights and all that kind of stuff. I think all those types of things allowed for people to actually be able to apply into medicine, but maybe before they were not thinking about it. So I think all these things in conjunction need to work in terms of inspiring mentorship, reducing the barriers into the accessing higher education, and then also understanding that it's expensive right now. And if we want to diversify the workforce, we really need to be reaching into communities that don't have the resources and giving them access to these.
it seems like that's a common thread across many platforms is access and accessibility. Now they're not just in the education department, but also to be able to receive healthcare. So all three of you have definitely experienced, myself included, from an administrative side, is people are unable to get the healthcare that they need at the time that they need it. So from each of your guys' platforms, what are you hoping to do, or what shift do you hope to see in the upcoming months to be able to make sure that people are able to get the necessary items needed to be able to take care of themselves and their families?
Yeah, I mean, I think for us, one of the challenges of emergency medicine is that it ends up being a catch-all. It is the place where people go when they can't get care. And this is especially, pertinent for underserved and marginalized communities. And so, my philosophy and the work that we have done has been to do our best to bring healthcare to our patients. So there used to be this almost debate within emergency medicine about what our role in preventative care and primary care is. And should we be doing asymptomatic STD testing in the emergency department? Fortunately, wiser minds sort of like rose to the top, and we do that. We do HIV screening in the emergency department. We do hepatitis C screening in the emergency department. We offer and distribute PrEP in the emergency department. And these are two groups of folks that literally the doctor that they see, when you ask a patient who your primary care provider is, they will name one of us in the emergency department because that's the person that they saw. And were it not for that, they would never have gotten that HIV test. They would never have gotten PrEP. And so the benefit in the long run in providing access is that, I'll add one extra thing is, there was a big explosion in telehealth during the pandemic. It has done wonderful things, especially in the field of mental health, especially in the areas of the country that are really underserved with regards to mental and behavioral health. But it's not necessarily the panacea. Just because you can have telehealth does not mean you have health literacy, by no means. And counting our touch bases by the number of people we have on telehealth is not the same as counting their health, their well-being, and those other metrics that I think can be just as important.
100%. And when we talk about mental health, I mean, that also impacts not only employers that we're seeing, but also like people that are coming into the emergency room. When I worked in the emergency room, I worked in the revenue cycle, and people were coming in distraught and in distress. And part of that is because they couldn't see their primary care doctor, or if they were looking for a therapist or a psychiatrist or a psychologist, they were booked out 3 to 4 months in advance, and they're having a crisis right now. And where do you turn to? You turn to the emergency room. But as for the care that the organization I was previously working with, it took several hours to even days before they would actually be able to get into a facility that was able to treat them specifically for that mental health concern. And part of that is just there wasn't enough resources in the community. And talk about supply and demand, we saw an uptick in pediatrics, but you also didn't have the care that adults needed. And so how do you best infiltrate that within a community?
Absolutely. I mean, pediatrics, psychiatrists and psychologists, it's like finding a unicorn. And I live in New York City. It is, our volumes have gone up by 20%. Our lengths of stay have gone up by at least 20%. And that is exactly that reflects the capacity of our health system to take care of children. And then, of course, as you mentioned, things like your social support, your connection and your networking are such important factors of your mental health, that being in quarantine and isolation and not having, in-person school and all of those things the last couple of years have certainly taken their toll.
Yeah. And I mean, I would say a lot of this also impacts social media, because a lot of people are sharing their stories on social media. So Joelle, I was hoping to kind of get your perspective on this. You talk about barriers and what people experience on social media, on Instagram, on TikTok, on different platforms, and how have these channels allowed more people to feel connected? But at the same time, it can also be a hindrance and can cause more damage if you're not looking at the right person, or if the content isn't filtered in an appropriate way.
Absolutely. It's something I think about a lot, having accurate information, making sure it's information that's actionable, that can actually help people, and it's not just raising fear or preventing you from going to the doctor. And a lot of the things I talk about right now are about healthcare disparities. So in all senses of the word, whether that's things like maternal mortality or different treatments for Black populations or COVID vaccine hesitancy, all that kind of stuff, I kind of weave into my platforms in order to talk about why it exists, the historical context behind it, what we can do going forward. The reason I even started doing it in the first place was when I was a second year medical student. I remember COVID had just hit. I'm sitting inside my room. I'm hearing about all these things happening. I kept hearing the Black community is more likely to get COVID. Yet in our classes, we didn't dive into the social determinants of health, those outside things that are also impacting patients and explaining why that was happening. So I started doing more digging, looking into it, and found a lot of shocking things. For example, pulse oximeters, which we use inside the hospital all the time, can overestimate oxygen saturation in Black patients. And there was a study that just came out a few weeks ago that showed because it was overestimating that oxygen saturation, many patients were turned away when they should have actually gotten care in the emergency department or been admitted into the hospital, specifically Black patients. And so many other things as well. When we look at even my own education, dermatology, we never really looked at what conditions look like on darker skin compared to lighter skin. And when you look at studies, they show that diseases like Lyme disease are more likely to be diagnosed later in Black patients compared to patients with lighter skin. So I started seeing all these types of things and all these disparities that were existing and started putting it online because I wasn't learning it in my own medical school classes. I was wondering, are people that aren't in the medical field at all, just patients wanting to get their own healthcare, are they receiving it? And the response has been incredible, both from people in the medical field, but also outside the medical field. I think one of my favorite series I've done so far is about dermatology and comparing how dermatology conditions look like on darker and lighter skin. And I'll get quite literally thousands of comments. Like the videos will get 5 million views plus, and thousands of comments of people saying, I've never seen like eczema on darker skin, or I've never seen hidradenitis suppurativa on darker skin. And it's people saying, maybe I should actually go to the dermatologist now because I didn't realize this could have been something, but maybe it is. And one of my followers actually reached out to me because I talked about a specific type of melanoma called acral lentiginous melanoma. And they ended up going to the hospital, getting it biopsied. It was precancerous. And so they reached out saying, thank you so much for like posting that video. I never knew that Black people could get even any type of melanoma. This is awesome that you're posting videos about it. So all that to say that I think the videos I'm putting out are really trying to reach a different audience, one that hasn't been exposed to the healthcare system, but has healthcare needs. And I think when we're able to put communities of color specifically at the forefront, we're able to hide in our overall system, encourage more people to go to the hospital, allow them to take control of their own health, and give them the language of medicine that they need to actually take advantage of bettering their own health.
Yeah. And I was going to say, if people want to follow you, if other Coke scholars want to join in on the conversation and become more educated or aware, what are your various platforms that you're on? And also, what's your handle?
Yeah, so I'm on TikTok is my main one. Instagram's another main one. Twitter, I'm starting to dabble in right now. But my handle is just my name, @JoelBervel.
Perfect. And you have like almost like, I think more than 1 million, if I'm correct, when I looked at it, right?
Not more than 1 million quite yet.
Okay, I feel like you're close. Okay, 500,000. Okay. You're up there for sure. And that leads me into Athena, talking about technology. You've created a nonprofit to kind of leverage technology to be able to make better informed decisions for healthcare organizations at large. So how has technology been able to influence your medium of ensuring that the conversation continues to improve and we don't become stagnant and move backwards?
Yeah, before Dreambound, I started a nonprofit called Coding It Forward, actually with another Coke scholar, Neil Maida, who's awesome, and some other people as well. But our mission was to improve the technological and improve how modernize these systems in federal government. So we worked with agencies like Department of Health and Human Services, Department of State, Department of Veteran Affairs to build better platforms that are directly touching very vulnerable populations. And I mean, that a lot is what informed my mission and vision behind Dreambound as well, which is actually a for-profit instead of nonprofit. But I saw that it really wasn't enough. I mean, for people who are very low income, who's the vast majority of our customers, especially like most of our customers at Dreambound are very low income Black and brown women. They are often on a lot of benefits programs like Medicaid and SNAP. But even those aren't enough to get someone out of the cycle of poverty and to improve their also health, because one of the big social determinants of health is definitely income, and even like maternal education level, things like that. And so you see that has a lot of cascading effects. As if someone's in this cycle of poverty, that affects their health, their outcomes, affects their children's health outcomes to come. And so we wanted to really break that cycle and help people get started in the field of healthcare. And that kind of allows us to, or allows those women to, and men to be able to start having the ability to provide for themselves and their families, while also pursuing something very like intellectually challenging, fulfilling in that way.
And Athena, I was going to ask you, it looked like undergrad and graduate students could be able to join in and actually get paid to be able to do some of the coding. Is that something like Coke Scholars could be a part of? So if they're in undergrad or going to graduate school, could they join to be able to help with the future?
Yeah, definitely. I'm less involved with Coding It Forward now, but it is a paid internship that was super important to us, because a lot of the federal government internships and government internships in general are unpaid, unfortunately. And that's something that's starting to shift in the tide a little bit, but it was very important to us. If you want to compete against Google, Facebook, software engineering internships that are paying, whatever, 8 to 10K monthly, like you need to be able to offer something that's just as competitive if you want the best talent to go work in government. So definitely a lot of organizations are helping out with paying for some of that. We also contract directly with the government or subcontract with them in order to get students paid. And it gives students the opportunity to be able to try something new and use their technical skills for good.
Yeah, well, it's another opportunity for Coke Scholars to get involved, especially if they're IT savvy, which is not me. But I wanted to jump in. I wanted to also share, we have a few emails that came in earlier that talked a little bit about Coke Scholars wanting to ask questions about just improving healthcare as a whole. So I was going to read one from a 2021 Coke Scholar. Her name's Chloe. And she asked, I'm currently interning at a nonprofit in Durham, North Carolina that assists with low-income citizens that need to be getting connected to various resources, including health insurance, so Medicaid, Medicare, and Marketplace. So recently, I have worked with several members who don't qualify for Medicaid or Medicare, but fall under the income requirements to sign up for the Marketplace insurance. She's asking, can you talk more about this gap in healthcare insurance for people who need it, and what are their best options?
This kind of highlights a lot of the gaps that we see in healthcare. I think one of the most publicized gaps was the Medicare gap, the pharmacy benefit gap, and that was way long ago, and it took a very long time to address it, if not. And I'll say, at least for my part, it's a lot worse for underserved and and marginalized populations. I always say it's like, if children could vote, they would have such better health care. It's unfortunate that it is that, but that's another one of the areas that is lacking. And so I think this is an example of this institutionalized biases that we have in our society that sort of continue to promote these disparities in care. I'm so glad Athena is doing the work that she is doing, because one of them are these internships. Like you have to be able to support and sustain yourself for a summer to get to be able to take advantage of some of these internships. We always talk about the Scholars Network and what kind of difference that being a Coca-Cola scholar can make to somebody's life that might be on the cusp or really not on the cusp at all. And whether it is the actual scholarship to be able to go to a school that they may not have been able to before, or to be in the network of folks that I and you and each of us here have really benefited from in the years since, I think it makes a big difference. So, I would say that it can vary state by state. Some states have already covered that gap. And so, North Carolina is just a little outside of my scope, may have a different approach than New York State.
Yeah, I agree. I mean, the coverage gap is insane. I remember looking into, I think, Alabama requirements. So maybe when the pandemic was just started, we were building like a portal to help people access their unemployment benefits. It was something like, if you were making 20K, you were not eligible for Medicaid, which is just insane. I mean, that is not enough to cover even your normal daily living expenses, much less another like $500 a month on health insurance, which is crazy. And unfortunately, like, because states kind of choose whether they want to expand Medicaid, that gap is going to continue to exist until those states decide to, who can close that gap. And so unfortunately, that kind of leaves it up to employers to fill up that gap, where if you get a job that has health insurance, that's really your only option, if not Medicaid or Medicare, or not being able to pay out of pocket. And if you can't get a job, I mean, you're kind of out of luck, but otherwise, hopefully, people have those pathways that can get them started in a role that provides for them in the healthcare benefits that way.
And Joelle, have you seen this too when you talk about healthcare disparities? I mean, people trying to figure out, at the end of the day, healthcare is a business, right? You have to be able to keep the lights on in the buildings, be able to pay the physicians, your nurse practitioners, and everyone that's a part of the team. But you recognize that not one person can't absorb that entire cost when they're needing care. They should be able to receive care at a reasonable rate. Have you seen this, and have you talked about this in some of your conversations?
Definitely. Yeah, I've talked about this a lot because many times I post a video to my followers and the comments will say things like, I'm worried about going to the hospital because it's expensive. Like, I don't want to get that surprise bill at the end of the day. I've talked
multiple.
A lot about multiple surprise bills at the end of the day, or talked about just like pharmaceutical drugs or just medication that you need and how expensive it is. I actually have a video coming out pretty soon talking about Mark Cuban and how he's putting out that new marketplace right now in order to try and have lower cost drugs for people. So I always try to do is point people in directions that they can try and subsidize costs or figure out what are some types of things that can be done in order to make healthcare more affordable for you. But I think healthcare overall needs to be more transparent. That's one of the things. It's one of the only industries where you go in to the hospital not knowing how much you're going to pay. And that should never be the case when there's things that are life-threatening. So it's unfortunate the amount of people I've seen in my DMs or even just that will stitch videos and make their own videos and tag me of saying, I can't pay for my medical bills right now. Can you highlight a GoFundMe for me? Or can you talk about this and get people to direct resources outside of the system to me because I can't pay for this right now. And I have cancer. I have this diagnosis I don't know what to deal with. That's a chronic condition. So from my perspective, it's just so disheartening to see how many people there are like that and hoping that more can be done in the future.
Yeah. One of the reasons I decided to go into emergency medicine is our doors are always open, right? Because of EMTALA regulations, insurance is not the first thing that we check. We do your vitals. We see how you are doing, right? And it is a common equalizer, but still with that, to your point, Kaitlyn, there's a saying that my mentor has said over and over: no margin, no mission. Right? You do have to keep the lights on, but we do that with the intent of serving those who otherwise wouldn't be able to, reach care. And so, but the truth is, many of the programs that we run are self-sustaining. It does take a little bit of seed money to say, if I do preventative care with this child with asthma, the insurance company actually saves a ton of money at the end of the year because they're not getting hospitalized. They're not going to the emergency department. If I identify and treat a patient with hepatitis C, the medicine's expensive, but so much less expensive than a liver transplant, a lifetime's worth of hospitalizations, and all of those things. So I think it really is important to be able to think of it in that way, and that we can solve many of these problems of healthcare inequity just by giving folks and giving projects a chance.
I love that saying, no margin, no mission.
I do too. And I was going to say, to add to that, from my experience, I saw when I worked in the revenue cycle, a lot of people came in and didn't know a lot of information about their insurance, like couldn't understand what is a copay, couldn't understand like what is the emergency versus a primary care physician. So they didn't even have the basic terminology to be able to best even understand it. So I would go back to this. I think one, if you're looking at different insurance options, it's also not only if you're looking at marketplace, if you call your local provider, at least for a lot of our patients that came through the door, if you call let's say an Aetna or a Florida Blue or anything and you spoke to a person, that means you're gonna have to wait on the phone for a very long time. And that's the issue too, right? So you'll be speaking to multiple different people, but you finally get a human and you say, this is the amount that I can pay. Some healthcare organizations will meet you where you're at, or I should say insurances will meet you where you're at. But there's so much legwork on the actual person to do all that, because now you have to make all these phone calls. You're going to talk to 20 different people. You're going to be put on hold, and that's a full day of work. So it was always a hard thing, because when patients would come into the emergency room, the most of the patients that I always worked with didn't have insurance. And then now they're going to have this massive bill, and it's not one bill, it's multiple bills, right? Depending on what, if they needed an MRI or what was scheduled and their various different diagnoses. And then the biggest thing is explaining to them, like, if you don't come up with a plan, a payment plan with the organization, this will hit your credit score. And then collectors will start calling you. So understanding that there's so many different nuances to healthcare, and how do we figure it all out? Well, that's the journey of hopefully where Coke Scholars get to lean into the conversation and help improve it. But I was going to say, I know we're getting close to the end, and I wanted to make sure we stop on a high note when it talks about like leadership and culture. And we're seeing a change and shift in healthcare, and the momentum's slow, but it's definitely there. What is your leadership style? What is your definition when you go into work and you're in these types of settings? How do you best put your foot forward? And can you share, what is your motto that you live by?
I'll start. So, I have always practiced servant leadership. And this is, I understand it's getting cool again. But it's something that I actually learned in high school. And I think one of the things that propelled me towards becoming a Coca-Cola scholar. And that really means a certain amount of humility that, my motto is always, I come into a meeting and I say, hi, my name is Anthony. How can I help? And in many ways, I think that kind of diffuses the situation to an extent that I know that we're all here to work together, and we're all here, doing whatever the common good is. On a grander sense, I think it's really important for us to develop compassion in the care that we provide. The struggles of the last couple of years have been really tough on us, and so it has underscored disparities in healthcare, disparities in the healthcare workforce for folks. And I think something as Joelle has brought up, how do we make our patients see themselves in the people that are taking care of them? And that is work that Athena is doing in bringing people into the healthcare field, and also folks that live in the neighborhood, that work in the hospital. That hospital works so much better because they're invested in the care that they're providing their neighbors. To the piece where I work with a lot in faculty development, in making sure that we have role models for our junior faculty. And more importantly, until the time when our healthcare worker population looks like our patient population, as much as I want our patients to be able to see themselves in their providers, I want my providers to be able to see themselves in our patients. And that goes beyond color, that's more experience, that's just humanity. And I think that's kind of the way that I approach my leadership style.
My motto in college was following the 3 C's: confidence, commitment, and conviction. It was mostly a joke because it was mostly in the context of like my friends and I were trying to figure out, should we jaywalk or not? And I was like, confidence, commitment. But now I've seen that what started out as a joke, I actually really like as a way to lead. I guess this is kind of the opposite of Anthony's, but I think starting a venture-backed startup really requires a lot of ego and thinking, you are able to change the world and healthcare system fundamentally with a team that's much smaller and trying to disrupt these like billion-dollar healthcare insurance hospital types of companies. And so, that's what I like to live by. I like to live with the conviction that we're able to lift, tons and tons of weight and get a lot done with a small team. But also, as a side, I really like to be not that serious too. I think it's important to have the fun, but also intensity at the same time. And that's how you make sure, your own team finds a lot of fulfillment in the work that we do and cares deeply about the people that we serve, but also has a good time while doing it.
Mm-hmm. Well, Anthony, you definitely stole mine. Mine is absolutely servant leadership. Similarly, in high school, that was like what my whole leadership class was about. It was about servant leadership, and the idea that you have this pyramid where like the CEO is usually at the top, but you flip that upside down, where you put the people that are typically at the bottom, the workers, the people that are going every single day, and you put them first, right? And you serve them first, you celebrate them, the same way that you think about something like the COVID pandemic and how it disproportionately impacted those that were first line workers, the people that were the janitors, the people that were the bus drivers, people that were the grocery workers. Like, they are the lifeblood of everything. And so when I think about leadership, for me, it's about empowering those types of voices, putting a microphone and holding it to the people who often don't get their voices heard, letting them tell their stories, because those stories are just as powerful, if not more powerful, than the ones we often hear broadcasted all the time. When it comes to my motto, I guess, overall, of like how I think about leadership, I really think it's about inspiring the next generation, which is what Coca-Cola is all about too. It's about telling one of my favorite things to do is listen to podcasts and read autobiographies, because it's so incredible to read about where people were at our stage of life, the things they were able to do, and the positive impacts that they can have in the future. So for me, my whole goal is to leave a legacy of inspiring other people to make sure that they can also start ventures and feel like they have the power to change the world and start conversations. And I think that's what being a Coca-Cola scholar is all about.
I hands down 100% agree with you. My motto that I've lived by actually came from a mentor who's the CEO of a hospital in Jacksonville. And he always said, your head and your heart are 12 inches apart. So use your heart to infuse your brain with what are the best business acumen choices to serve your population, to serve the community. And so I always like to think, like, when I'm making a major decision, or if there's a conviction, or if there's something I need some confidence in, I go back to, what is my heart saying? And what's the best direction to be able to help others? And that goes back to, Anthony, what you mentioned just a second ago, is how can I help you? How can I serve you today? And that is what you just mentioned, Joelle, is literally the Coke motto. I feel like that we all embody as Coke scholars. So with that, we're going to head into the Fast Five, which they told me it's got to be really quick. It's the first thing that pops into your mind. So to change it up, the first question is, what are 2 apps or websites you can't live without? Any takers?
TikTok, Google.
I still don't have TikTok
Amazon
yet.
and my Outlook.
Okay.
I was gonna say Slack and TikTok, ideally at the same time.
Okay, so that means I need to download TikTok. And my favorite is Trello, because I love it as it keeps me organized, and especially on the different projects, and I can communicate with a lot of great teams. But that's the only app that I can really, or website I can really think of. The second question: if I looked at the music that's on your iPhone or iPod right now, what would surprise me?
One of my favorite artists is named Madion, and his last album was like gospel choir EDM, which was sick.
I am currently listening to the Pride playlist on Spotify, and it's amazing.
Ooh, okay.
I don't know if this is surprising, but I've had Beyonce's Break My Soul on a repeat. Then also Harry Styles' As It Was. They have, like, literally this morning I was showering and it was blasting. So that's my playlist right now.
That's a good way to start the day, for sure. The third one is favorite book or piece of music or art that has helped or inspired you in your life.
Mitch album, Tuesdays with Maury. I still love that book. I still read it occasionally.
A book I love is Delivering Happiness. It's about Zappos and kind of their company culture and how they kind of really focused on happiness and customer care. I don't know why, but it had a huge impact on me. Just like how can you use companies for like social good while at the same time doing a lot.
This is not something that I read early on in life, but I've been obsessed with this series called The Cradle series by Will White. I'm just waiting for the next book to come out. It should be like 2 weeks from now. I'm waiting. I'm ready.
What is the Cradle series about?
It's about this guy. He's in a planet of like 100 billion people, and he is the one person who doesn't have like magic, and he has to save the world. And I like to think maybe there's some message.
Oh, he's the underdog.
Yeah.
Oh, I like that. Okay. And he has to put his talents to good use. So the fourth one is, what quote or motto do you live by?
Confidence, commitment, conviction.
The 3 C's. I have that one.
No margin, no mission. I'll pull mine from No Margin, No Mission.
I like that too. Yes.
Mine will be a setback is a setup for a comeback.
Someone that I met when I was in middle school told me it only takes one person to move a mountain, and then others will follow. And that was the last conversation that I had with her before she passed away. And I wrote that in my journal. And still to this day, a lot of the reason why I do something, and sometimes like, you know, when you need that entrepreneurial spirit and you're like, oh, I don't know if I can do this, it's a little daunting. There's other people who are doing it. Can I do it? Yes, I can. Comes from that quote. It only takes one person to move a mountain, and then others people will follow. And when I hear your guys' stories today, I feel like you guys are change agents and you are moving mountains in your own lane. And it's such a beautiful thing to see. So thank you for what you're doing. Okay, fifth one is, what makes the Koch Scholars program or network unique? I feel like that's the easiest one.
It is lifelong. It is not a 4-year scholarship. It is a, membership in the greatest club you could ever be in. It is just a bunch of like great networks, great resources, always a friend in any city that you're at. And it is, again, it's lifelong. Here, me and my son had he had his first Coke float a week and a half ago.
I love that.
we not so much soda, but Coke floats are fine. So it is a lifetime activity.
I love that.
Kind of piggybacking off that, I mean, just Coke Scholars are literally everywhere. I started coding it forward with one, and I didn't even know he was a Coke Scholar until we were a few months in. I share an investor with another one. There's another one. I was like part of a founder peer group, I guess, that I started yesterday, and it was organized by Coke Scholars. So yeah, they're just everywhere, whether you know it or not.
For me, yeah, definitely the family piece of it. When I say like quite literally my best friends are Coke Scholars, like it's not an exaggeration. I could name 10 Coke Scholars who I talk to every single day. So it's a family that never goes away. And thankfully,
literal family for you, right?
Literal family. It's kind of amazing.
I love that. I always say the same thing. I like to say we're a dysfunctional family, like a fun family that everyone has different backgrounds, stories to share, past experiences. And when we all get together, it's literally like we saw each other yesterday, even though time has passed, right? It's been 3 years since I've really chatted with Kaitlyn, and it was like, oh my gosh, on the phone yesterday. I felt like I just talked to you last week. And then in August, kind of like the same thing. I'm going to a Coke Scholars wedding, and she's been my friend and my confidant and my BFF throughout the entire journey, and she's from my same year, and vice versa. Every time I go to another Coke Scholar event, I meet other like-minded people, and I just fall in love with our family that continues to grow every year.
Mm-hmm.
So thank you so much for taking the time to be able to chat with us today about improving healthcare systems. I'm just grateful for what you're doing in your lane, but also the grit and tenacity that you have of doing all the work to be able to improve healthcare, but doing it with heart and intention. And there's meaning behind everything that you're doing through your service work. So thank you.
Thank you.
Thank you.
We hope you enjoyed this episode between Anthony, Joelle, Kaitlyn, and Athena. For links to their full bios and other things they discussed, check out our show notes or visit coca-colascholarsfoundation.org. And if you have an extra minute, we would love for you to rate the show, leave us a review, and subscribe so you'll be the first to receive new episodes. This concludes our 3rd season of the Coke Scholars Ignite podcast. I've had such a blast being part of the SIP, and I hope you have too. If you'd like to stay in touch, you can find me at Aisha Sheb, AISHACHEBB, and I'm looking forward to seeing you all very soon. Season 4 will feature even more incredible Coke Scholars. Subscribe to be the first to get new episodes. Thank you for joining us for the Season 3 of The SIP, where we give you a taste of how Coke Scholars are igniting positive change around the world. See you next time. Bye.